Well, now you know what I do for work, but my most important role is not at work. My most important role, and I'm sure all of you relate to this, is actually at home. I'm married to the most patient man in the universe, and I have two children. I have a 13-year-old daughter and an 8-year-old son who I love more than anything in the world. They are kind, funny, smart, hilarious, infuriating, and challenge me in ways that I could never possibly have imagined. And it's because I have these wonderful little people at home that I find critically ill or injured children particularly emotionally challenging to deal with. So then along came 2007, and the universe conspired to give me a whole bunch of these, and this was a really formative learning experience for me. So in January, 2 days before I was due to go on holiday, we went to a 2-year-old boy who drowned in a fish pond in the backyard of a family friend's place. Absolutely tragic. Followed a couple of months later by another 2-year-old injured in an MVA who sustained a head injury and a splenic laceration. Fast forward to August, and an 8-year-old boy mucking around in a schoolyard on a Sunday went up into a roof to catch a ball, fell off, sustained a head injury, intubated, etc., etc. Then we fast forward 1 month later, we went to a 9-year-old girl who fell off a horse and sustained a severe traumatic brain injury and a nasty left-sided chest injury. And the last thing I remember from that job was delivering this patient to the neurosurgical theatre. And as I turned around, I saw her beautiful brown hair cascading off the end of that operating table. And I just remember thinking, as I started to shave her head, thinking that's exactly the same type of hair as my own daughter. Then there was a mother of all jobs. Well, not quite the mother of all jobs, but certainly one of the more challenging jobs I have done in my career. And it was this one. So this was a Tuesday morning like any other morning, with a busy mum distracted by a whinging child in the back seat. Her foot slipped off the brake and onto the accelerator of her 2-ton SUV, and it went ploughing into the classroom directly ahead of her, seriously injuring 2 8-year-old boys. And the thing about this is, most of the kids we go to have maybe been doing something a little bit naughty or been doing something where they weren't supposed to be. But these 2 8-year-old boys were at school doing exactly what they were supposed to be, and in the safe place that many of us deliver our own children to every day and don't think twice about it. 2 workmen rushed to take these children out from underneath the vehicle. They delivered them to the tea room. When we walked in, there was CPR in progress on one little boy, and the other little boy was peri-arrest. My colleagues who arrived, another medical team, they came and took the peri-arrest child, and we focused on the child on traumatic cardiac arrest. And as I'm cutting into this little boy's chest doing the thoracostomy, this body is so familiar to me. The sticky outy ribs, the gangly arms and legs. It's the same body as my own son. And there's a piece of me that's thinking, you know what, this is so wrong. Every little bit of this is just wrong. Now, we are well trained, and this is why I'm so passionate about education and training, because it allows us to do our job, even under really challenging circumstances. And I was really proud that day to be part of a wider emergency services team that really stepped up and did a 200% job and gave those little boys the best possible chance. But the horror of this situation did not escape anybody that day. So, why is it that these paediatric jobs, why do they get us so much compared to all the other stuff that we do? Well, I think there are 3 main reasons. The first reason is that, 1, we are hardwired as human for connection, and empathy is part of that. These jobs force us to very briefly walk in the shoes of that family that suffered the most unimaginable loss or trauma, and we feel their pain vicariously. It also makes us think, just for that horrible moment, what if that was my child? The second reason is this concept of moral injury. Now, I would suggest to you, and I really hope here, I'm making a bit of a presumption, but I hope that you would all agree with me that we all have a deeply held moral belief that children should grow up safely, happily, and healthily, loved by their families, and grow up into the adults that they are supposed to be. When we go to a critically injured child, or particularly a child that dies, this really transgresses our deeply held belief and causes us a moral injury. And the last reason is that it opens up our Pandoras Box, our own Pandoras Box, of our most deeply held fears and our vulnerabilities and our weaknesses, and that's a really scary place to be. Elizabeth Stone, an author, once said that the decision to have a child is momentous. It's just to forever have your heart walking outside your body, and of course that makes us particularly vulnerable in this area. So, on the topic of vulnerability, I'm a massive fan of Brené Brown's work, and I'm not sure if any of you have seen her TED talk on power of vulnerability, but I commend it to you if you haven't already. So she says, she's a storyteller researcher from the States who spent her whole life researching human connection, and she's come to the conclusion that vulnerability is a massive part of this. And she says that I believe you have to walk through vulnerability to get to courage. You need to embrace the suck. And you know what? It's okay. To be vulnerable is to be truly human, and none of us want to lose that. So, the R word. So the question for me then is, okay, we have to embrace vulnerability to get to courage, but then how do we process these things that happen to us to allow us to emerge with our hearts and our mind intact? And surely this is where resilience fits in. But you know what? I wrestle with resilience, because to me it is the R word. I think it, honestly, it's my own opinion here, I think it's the most overused and misunderstood term in healthcare these days. It is the R word for me. And yeah, I don't know, is it some sort of coating or armor that we put on so that bad things just deflect off us and slide off us like Teflon? Yeah, I don't think so. Is it a box of tools that we give ourselves or give to others, and we teach them how to use them in the vain hope that they're going to be able to apply the right tool at the right time and remain unscathed? Doesn't work for me either. So I'm going to replace the R word, resilience, with another R word, road. And what do I mean by that? I think when these things happen to us, I think we have to go on a journey. I think we have to walk a road, and we have to be transformed by our experience and learn something from it to emerge with our heads intact. And you know what? Our road, each of these experiences has a road in front of it. The road may be short, it may be long, it may be tortuous, but there are no shortcuts, and there is always a road. And what do we need? It's not just an aimless journey. We need to have some form of direction, and we need to have a seriously fabulous pair of shoes. That's essential. So what are we going to use for a moral compass and a set of directions? Well, I really like this paradigm by Dr. Adam Fraser, who's a psychologist from Victoria, who wrote this book, The Third Space, which talks about the transitions in your life. And actually, I think it works really well for this. It's a three-phase framework where we talk about reflecting, then resting, and then resetting. And in the reflecting phase, the first one, he says you need to ask yourself 3 questions. Is it accurate? Is it realistic? And is it optimistic? And this acknowledges the fact that you can tell yourself one story that'll keep you awake at 3 in the morning for months to come. Or you can tell yourself another story, which allows you to humbly and frankly and honestly evaluate what happened, learn the lessons, and then move on. Then you rest for whatever you need to, and then you reset. You get back on your feet, you take those lessons that you've learned, you emerge wiser, and you decide who you're going to be when you step out back into the world. True teaching is not an accumulation of wisdom, not an accumulation of knowledge, it's an accumulation of wisdom, and it's an iterative process. Each time we do something, we have to reflect on it, and we have to learn from it, and that is true teaching. So, what we do, team, all of you, what you do matters. It is raw and it's unpredictable, but the courage to be vulnerable is the courage to show up when you can neither predict or control the outcome, and be okay with that. I wish to retain our empathy and to remain human. It's important that we are all comfortable with vulnerability, really comfortable with vulnerability. You need to be able to know that you need to walk the road, you need to be able to ask for help, and you need to be able to use our moral compass to guide us, and so that we can learn the lessons that we need to learn on a daily basis. I'm a Kiwi, as you can all hear. I'm very proud to be a Kiwi, but I'm most proud of what our colleagues did under absolutely unimaginable circumstances in Christchurch last week. To all of those people involved, may your road be short and your lessons be powerful. Kia kaha, Christchurch, stay strong. Thank you.
Thank you for being vulnerable. How do we find space to be vulnerable when you've had a difficult case like this? We know what happens. The waiting room starts to get fuller and fuller. You've got children with minor injuries and minor illnesses. Your team's been busy for an hour and a half, 2 hours with a difficult case. Things end badly, and you need to move on that minute because you've got a full waiting room. How do you find the space in that context to be vulnerable?
I think that's a great question, and it's something that I'm passionate and actually actively working on at the moment in most of my jobs. I think that comes from senior leadership, is I think where that comes from. I think it needs to be from the exec downwards, and so the management downwards, to acknowledge that it's important to give your teams time and space to be vulnerable. And it's important to acknowledge that we are all vulnerable as people, and that's actually a really powerful and important thing. So you know what, if those waiting room patients take 5 more minutes to be seen, to allow the team to have a discussion, and a vulnerable discussion at that, and acknowledge that they won't be back on their feet for another little while, and that's okay. And maybe they do need to have a timeout, and maybe they need to go home. Then that, I think, protecting our workforce is far, far, far more important than seeing the next patient, if I'm honest. Yeah.
Thank you very much.
Thanks.
Thank you.